Hello, welcome to your facial rejuvenation appointment at Clinic Visage. My name is Dr Visage and this is my clinic. You may have guessed. So, this is your first appointment coming to see us? Excellent. Well, it's lovely to meet you. How did you hear about us? I always like to ask. Oh, wonderful. Well, word of mouth is always, in my opinion, the best way, because then you know your clients have left happy. Okay then, let's begin by making some notes. Okay. Before we begin, are you nice and comfortable? Wonderful. Can I get you another glass of water or tea, coffee? You're okay? Okay. Will you just let me know? So, let's get up a fresh page. Okay. So, it's wonderful to have you here today. Just write down the date. Okay, now what made you book this initial consultation? A special birthday coming up? Is it your 40th? Joking. Oh, sorry. I should probably stop doing that. No, you look fabulous. Okay, but we could get you looking even better. Okay. So, right then. Your date of birth then, please. Lovely. I have a best friend who's born on the same day. Okay, right, and what are you really hoping to achieve here? Like, is there a particular area of the face that bothers you and you'd like to refresh or change, or are you looking for a complete facial overhaul? Right, I see. Okay, so there's potential that we could look at doing some non-invasive treatments, so your derma fillers and Botox, which can actually be really effective. Okay, so what I'd like to do is I'd like to just get your perception as to what you really want to achieve with certain parts. So with the lips, obviously we've got a lot of different shapes here. So you have your full upper and lower lip, more of a thinner shape there, more of a defined cupid's bow. We have bigger bottom lip to top lip, and the reverse way round, of course. So are there any here that are really standing out to you? Okay, so you quite like this one. Yeah, this one. You like the cupid's bow here. This one. Okay. Any others? Okay, lovely. gives me a little bit of an idea. Good. Let's move on to discussing the nose shapes. So, let me talk you through these. First off, we have the hooked nose, often known as the broken profile. Then have the droopy nose, so the tip tends to come down a little bit lower. People can associate this more with signs of aging. Some people do just have that nose shape. Then you have the aquiline, otherwise known as the eagle-like convex. You then have the Roman nose, which is slightly aquiline. You then have a Grecian nose, which drops straight down from the forehead. Then you have the button nose, often quite desired because it looks quite cute. So this is quite rounded and small, and it's just very cute. Then you have more of the upturned nose, or concave as it's known. And then the snub nose, aka the pug nose. And then you have the funnel, so the nostrils pass over the bridge. So which of these would you say you currently have? I would agree. Okay. And are there any of these shapes or styles? And we can do a little bit of a combination. Is there anything here that you think, I would like that nose? So you quite like the aquiline, okay. Yeah, the Roman is a good nose, but you like the cuteness of the button. Okay, interesting. And let's move on to talking about your facial shape, because for me, whenever I'm doing enhancements or surgery, I do like to review whether the features are going to look right on the actual face shape, because some people want to do quite large enhancements and it can just look out of proportion with the face. So let's have a look. We have the oval, the square, the round, the heart shape, and the oblong. So which of these do you identify with? I would agree. Good. The reason why I ask for these things, what do you identify with currently, is because sometimes people can have a little bit of a skewed perception as to what they, really look like. But very good. So, based on that, I would say, because you have quite a flexible face shape, and what I mean by that is your face shape allows me to actually do pretty much anything. Very, very lucky. And what I will do in a moment is I will do some measurements and do a little bit of a mapping based on what you've told me. Okay, so next I'll just quickly show you the eye shapes. Okay. And the reason why I like to show these are we can actually do slight alterations to the eye shape based on the enhancements we do around the eye area, which I'll explain in a moment. So I would say we have the almond, wide set, close set, round, downturned, prominent, upturned, big eyes, deep set eyes, and small eyes. So I would probably say that you have between the almond and the round. So if you wanted to create a slightly different shape, perhaps more of a cat eye look, we would do that by doing some injections up here, and that would lift the eye area, just pulling the corners of the eye up. Okay? I think so. I think the thing is there are so many different options. So why don't we do a little bit of measuring to see what we're currently working with and what you would like to achieve. So we'll start with the nose, as this was an area that you did potentially want to look at getting adjusted. Okay, so come down. Good. Measure across here. Good. And I'm just going to measure sideways here. Okay. That's lovely. Just make a note of those. Okay, so the nose at the moment, if you just turn to the side for me. Okay. Hoping to achieve more of this shape. Lovely. You've got a slight raised bump just there. I've got a couple of different options. You can turn back round, sorry. So, just here, I could just do a little injection of a filler. And what that would do for your profile is you would just even it out. So with surgery, we could effectively break the nose, remove the bump, reshape it, and that would be done. Or you can go for a cheaper, quicker option with results that people are very, very happy with, and just do that injection just there to simply just smooth it out. Now, if you were hoping to achieve more of that button look, that would need to be done through surgery. Okay, so it's just deciding what's right for you. I would perhaps suggest to try the injectable option. Then if you weren't too happy, you wanted to change the shape of the base of the nose, then that's something we could look at. Okay, great. Next what I'm going to do then is I'm going to measure your lips. So you said that Kylie Jenner's your inspiration. Okay. What I like to encourage people to do when they're thinking of having a procedure done is to look at different celebrities, and I say to them, don't go by gender, just look at certain celebrities and pick out bits that you really like. So you may like the jawline of the member of the opposite sex, and so on. So, okay. And are you hoping to achieve then more of a Cupid's bow? This bow? Yeah? Okay. So, the Cupid's bow is quite desirable. It can be a little trickier to achieve, especially if you have no existing shape. If you have a little bit there, then what we can do is do the injections more towards this point, and that will create more of a lifted effect in that area. That will push this part here out, so it depends how much of a raised profile you would like, but that's up to you. So let's just write down your measurements across here and down there. Yes. For me, I always try to say to just go with what's right for you rather than kind of sticking another person's body part onto you. So my professional opinion, and we'll do the mapping out in a moment, but my professional opinion would be to increase the size of the lower lip just slightly, and just to increase those cupid's bow just a little bit. Then moving on to the nose, again I would like to just smooth that out. I think that will create a really nice side profile, and also from the front it'll look a lot smoother. Now, looking at you as you are, so to increase the symmetry, I'd like to do a little bit of plumping in the cheek area. We'll do it over here as well, of course, but we'll keep it slightly less over here. And then turn to the side for me. Okay, turn back. The other side. Turn back. So I would suggest doing a little bit of the filler just here. So that's going to pull up the jawline, because what we want to do is we want to build the face up. What we never want to do is to do all these different injections and then actually you end up with a face that's too top heavy or too bottom heavy. So for me it's about building up the face and then adjusting. So as we age we tend to lose a bit of elasticity and the collagen in the skin. I would suggest a bit of Botox around the eye area. It depends. Have you ever had any work done before? Okay. So, as you haven't had it done before, I would say that the first time you have it, you'll probably need to have it done again in a few weeks' time. The more you have it done, the less you need top-ups. So just looking here, yeah, the skin is in a good condition to be able to do that. I'll start the injections around here just because it's good to lift it from here. If we inject too far down, that could cause, in simple terms, there is a medical term for it, but it could cause a droop in the eye area. This can cause semi-permanent eyelid drooping. You could have that for a few months. So it's very, very important that we inject at a certain point. Okay. Now, do you have any other questions before I move on just about the Botox that I'm recommending? Okay, so that's quite a common misconception. Just relax your face for me, and now smile and frown. Good. Okay, so Botox is actually a muscle relaxant. Okay, so it relaxes the muscles. People think that it tightens the muscles up. it does the opposite. So what happens is, imagine you have a line across your forehead. You inject into the areas around here, and it relaxes that group of muscles, allowing the line to just disperse. Okay, so that's why we have to be careful in certain areas, because when you cause the muscle to relax too much, that can cause things like the drooping. Okay, but where I'm thinking of doing it, I think it will look really effective. The jawline here and the cheek are going to be done with fillers. Okay, now there are a couple of different options that we can look into, just based on price points really. They both have nearly the same level of effectiveness. One lasts for around 12 months, the other closer to 18 months to a couple of years. Okay, but by doing fillers instead of the Botox, it's going to rebuild those areas and lift the face. So I think that's going to look really, really great. Now, looking at the eyebrows and the eye shape, I do think we'll do a little bit of Botox just around here. I don't think I'm going to do any filler around there. It's just really under the eyes now that I'm thinking about. Okay. Right, and a frown for me. Yeah. Okay, so the eye area is quite tricky. You want to be very, very careful. I would personally recommend a filler product called Sunacos, and what we're going to do is inject just under here. Okay, and that's going to just boost underneath the eye area, helping to reduce the darkness and that kind of dip that creates the shadow. That's what I would recommend. You can have a think about it. No, so we wouldn't do that by pulling the skin. All we're doing is plumping the skin to create more of that youthful appearance. Yeah? Lovely. Okay then. Well, based on what we've discussed, what we'll start to do then is we'll just do a temporary little map out of where I would place the injections and also where we would do the enhancements. Okay, so let me just take my erasable pen. Don't worry, this comes right off. Okay then, so starting with the nose. So I think we discussed the injectables, so I would do it there. Now I don't want to place any filler here because it can look quite fatty, so we'll do the Botox. Now when people talk about getting Botox, they often talk about getting it done in just one place. What people don't realise is it's actually quite a lot of injections per zone. So in the forehead area, we typically as standard be looking to do around 18 injections. We would be applying a numbing cream. It's normally applied about half an hour before. Okay. It's going to also create a little bit of a lift to the brows to open up that eye area, and then we'll continue the Botox around the crow's feet area. Okay, now we didn't discuss the folds in the skin just here. That does bother you. Okay, so normally what I like to do is put a catheter in, just a small one just here, and then I will go in with the derma filler. Now this nerve just here does actually connect all the way up, okay? So you have to be very careful, like with all injections, but I am obviously at liberty to tell you that. But I think that would give you the best results. I would suggest, based on the elasticity in this zone that you have, that we do go for the pricier filler. It's going to last you longer and it is going to really do the job. So let's mark that out then. So we discussed down here and down here. Then we're going to come across. There we go. Just draw a couple of lines there. So what I've drawn is where we're hoping to get that lift in the cheek to create that more defined area. Do the same just here. And also we discussed just along the jawline. And then under the eyes, so great. Okay, take a look in the mirror just to see where we're doing the injectables to start with. Yeah, which line? This one? Yeah, turn back around. Okay, so if we place that a little bit higher, no problem. Okay, now let me just draw where I want the lips. So I'll go down here and here. I'm also going to just put a little bit of that filler left over from here, just here, just to lift the sides of the lips. Okay, great. Right, look in the mirror. Tell me what you think. Is the placement right for the lips? Yeah. Good. Perfect. Okay, what I'd like to do then is I would actually like to take some pictures, if that's alright. Great, so I do just use my phone for this. Okay then, so let's get this up and ready. Right, okay, so just stand nice and still for me. Great, and turn to the side, and the other side. Great, just come a little bit closer to you. Okay, a couple this way. Great. Okay then. So let's write down the plan that we are going to do Okay. So, what I will do based on those pictures is I will get all of that drawn up on our computer system so we can map everything out for you. Okay, so we're going to do, I like to call it a little lunchtime nose job because it only takes around 30 minutes. So, going to do that. Going to do the Sunakos under the eyes and the Botox in the forehead, crow's feet, fillers along the upper cheek and also the jawline to help with definition, and then enhancement to the upper and lower lips, creating a filler cupid's bow, and then filler down the nasal folds. Lovely. Okay, so let me just cost this out for you. So we have 1, 2, lots of the Botox. Now these Sunakos we do recommend having done in a treatment group of 4. However, patients, it really does vary. Some can notice it in the first go, some can notice it after a couple, so just making you aware of that. So I'm going to put down 2. Then we have the pricier filler but just in the one zone, and then we'll do the alternative filler which is still very effective in the cheek and the jawline. Okay, so this is the costing. Okay. Yeah. No, that's the costing there. May go up just a little bit. We do have payment plans available. Yeah, of course, that's fine. We do have to take a deposit if you would like to go that option though. Okay, wonderful. It is non-refundable. Okay then, well that is everything. Alright, do you have any questions based on my recommendations? You are going to look at least 10 years younger. I promise. Okay, so I have actually run out of my wipes to do the removal of the pen. So if you would like to take yourself up to our bathroom, okay, you'll find some wipes in there. Is that okay? Perfect. And then when you're ready, just book in with reception. Okay? Not a problem. It was lovely meeting you. Okay, and we'll have that new face to you in no time. Okay? Lovely. Bye bye then. Thank you so much. Okay. No, it's fine. It's fine. Yeah, just close it actually. Thanks. Oh my god. Okay, don't panic. Permanent marker. Is it definitely permanent? Oh my god. Why did Belinda buy the permanent markers? Okay, right. Just going to have to excuse myself. Okay, they're gonna be out that way and probably discover this permanent marker in about 2 minutes. So, okay, just dial through to reception. Belinda, hi. You know those pens that you ordered? Yeah, they're actually permanent. Yeah, that person that just walked past you, yeah, that's permanent pen. Yeah, it's a lot of permanent pen. Okay, so what I'm going to need you to do is just tell that person that I have now left for an emergency. No, I'm going to let you deal with them. Okay, bye. Yeah, bye. Oh my god, right. Out the back door.